you know Sigmund Freud ka contribution. Who is Sigmund Freud? Who is Sigmund Freud? Father of psychoanalysis. So he divided the 5 psychosexual stages of development. Okay. So what was the concept of Sigmund Freud regarding the pathophysiology of any mental disorder? There is fixation. Fixation in the developmental stage, either oral phase, anal phase, phallic phase, latent phase, or genital phase. There will be fixation in the particular stages of development. In same way, according to Sigmund Freud, there will be fixation in the early developmental stage. Okay, and also there will be disintegration of the ego. What is ego according to Sigmund Freud? You know Sigmund Freud classify kiya? Structural theory. Id, ego and super ego. So how will you differentiate all these 3 structures? Okay, so ego is governed by reality principle. Id is governed by pleasure principle. They want pleasure. And super ego is governed by morality principle. So according to Sigmund Freud, there will be disintegration of the ego. So there will be excessive aggression. So actually ego balances id and super ego. If ego undergoing disintegration, what will happen? All the repressed ideas, wishes will come out, like excessive aggression and sexuality. That is the main cause of schizophrenia according to Sigmund Freud. And according to Margaret Mackler, so according to her, there will be disturbances in the relationship between the mother and infant. Okay, the schizophrenia will start in the childhood itself. Okay, when there is an abnormal relationship between the mother and infant. Okay, and according to Paul Fedel, he just combined the concept of Sigmund Freud and Margaret Mackler. Means there will be ego disintegration followed by disturbance in the harmonious relationship between mother and infant. Okay, that is the concept of Paul Fedel. Then Harry Stack Sullivan, schizophrenia starts when there is a disturbance in the interpersonal relationships. That was the concept of Harry Stack Sullivan. There will be disturbance in the interpersonal connections. Okay. And there are certain family dynamics which can cause schizophrenic symptoms. Okay. These are all called dysfunctional families. Dysfunctional families. For example, double bind family. पता है क्या double bind family क्या है? Double bind family. It is a hypothetical family. It is not a real. It's only hypothetical family. Double bind family matlab there will be contradicting or conflicting parental messages to a child. The child is getting conflicting parental messages. For example, mother is saying to the child, you should be independent. You should be independent. When the child started to take his own decision, she will blame. Okay, she told you should be independent, but when the child is taking his own decision, she will blame. That is called a double bind. So he will be confused whether I should follow her or whether I should take my own decision. Okay, that is called a double bind family, one type of dysfunctional family. And schisms and skewed families. What is the meaning of schism? Schism matlab? Here there will be one parent will be overly attached to opposite gender baby. Suppose father is overly attached to daughter. Mother is overly attached to son. That is called schisms. There will be same, the other child will have some insecurity feeling. Okay, so it can also predispose to schizophrenia. Then skewed families, matlab, here parents will compete with each other, and who will, one parent will dominate, and he will express more love and care to one child. That is called a skewed family. Okay, parents will parents will have dispute with each other, and they will try to dominate. That is called a skewed family. And pseudo-mutual and pseudo-hostile family. Pseudo means false. It is a false mutual family. Matlab, externally we can see the family is very perfect family. There is no dispute between anyone. But they are hiding all their aggression, all their emotions, and they are just expressing outside that our family is very good family. There is no problem with our family, but actually their family is having lots of problems. That is called a pseudo mutual family. Then what is pseudo hostile family? Just opposite. Means externally they are very aggressive families. They are not showing the warmth and the love towards their children. They are just suppressing their true emotions, and externally, even for a small matter, they will blame the child. That is called a pseudo hostile family. They are suppressing the real love and care towards their children, and they are expressing just anger to their children. That is pseudo mutual and pseudo hostile families. So these are the ICD-11 diagnostic criteria for schizophrenia. You should follow these. Now we are not using ICD-10 criteria. We are using ICD-11, or we can use DSM-5. DSM-5 text revision is also we are now using. So according to ICD-11 diagnostic criteria, these are the symptoms. 7 symptoms required for diagnosing schizophrenia. There should be persistent delusions, persistent hallucinations, disorganized thinking in the form of formal thought disorder, experiences of influence, passivity or control, negative symptoms, grossly disorganized behavior that impedes goal-directed activity, and also psychomotor disturbances. Okay, so the duration for diagnosing schizophrenia is 1 month. This is very important. For depression, it is 2 weeks, and for schizophrenia, it is 1 month. Okay, according to ICD-11 criteria. If you go for DSM, what is the criteria? Sorry, what is the duration? 6 months. Okay, 6 months according to DSM-5, 1 month according to ICD-11. Okay, so among these 7 symptoms, 1 symptom should be among A, B, C, D. Any symptom from A, B, C, D should be there. Without any symptom from A to D, we can't diagnose schizophrenia. Means there should be at least persistent delusion, hallucination, disorganized thinking, experience of influence, passivity or control. 1 symptom should be there from A to D. Okay. Then if you see ICD-11, there are certain course specifiers are given. Course specifiers are given in ICD-11 criteria, and first specifier is first episode. Schizophrenia, first episode, currently symptomatic. Matlab, the patient is having the first episode of schizophrenia. Now also the patient is symptomatic. Now also the patient is shown. Then in partial remission means the patient had a diagnosis of schizophrenia, but now the patient is not fully satisfying the diagnostic criteria of schizophrenia. That is in partial remission. In full remission means patient is actually schizophrenia patient, but now the patient is not fulfilling any criteria of the diagnosis and also unspecified. Okay, this is first episode. Then same criteria for multiple episode. Currently symptomatic, in partial remission, in full remission, unspecified. Then we can say it is multiple episode. How many episodes should be there for multiple episode? Minimum 2 episodes. Then only we can say it is multiple episodes. 2 or more episodes should be there. Then same continuous. Schizophrenia continuous. Then also currently symptomatic, in partial remission, in full remission, and unspecified course. Okay. So you have to diagnose according to this only. How will you diagnose? Suppose if you get a case of schizophrenia, just write schizophrenia, first episode, currently symptomatic. Then only it will be a complete diagnosis. Don't write simply schizophrenia. Based on the course specifier, you should elaborate. Then only the others can read and understand whether the patient is having symptoms now or not. Okay, this is the correct way of diagnosing schizophrenia. Then there are certain subtypes of schizophrenia, you know. Types of schizophrenia. ICD-10. You know ICD-10. Okay. ICD-10 classifies schizophrenia into different types. But in ICD-11, is there any classification of schizophrenia based on the types? In ICD-11, they are not following ICD-11. No. In ICD-11, there is no such a classification. पूरा हटा दिया उन्होंने. There is no such a classification of schizophrenia on the basis of types. Now there is no subtypes in the textbook like ICD and DSM. DSM-5 also there is no types. You know, only the criteria is given. There is no types like paranoid, heavy feeling. There is no types of schizophrenia. Okay, but for theoretical purpose, you should study all these types of schizophrenia. And the most common type of schizophrenia is what? Paranoid schizophrenia. Paranoid schizophrenia. What is the main feature of paranoid schizophrenia? Main feature क्या है? Delusions and hallucinations will be prominent in case of paranoid schizophrenia. Affective symptoms will be very less. Okay. Then second type is disorganized, yeah, heavy phrenic schizophrenia. What is the main feature? Their affective symptoms will be more prominent. Affective symptoms will be more prominent. Delusions and hallucinations are less prominent in case of disorganized schizophrenia. And the onset is also early onset compared to paranoid, which is late onset schizophrenia. Then catatonic schizophrenia means characterized by catatonic symptoms. What is catatonia means? Severe disturbance in motor function, that is called catatonia. So what are the different types of catatonic symptoms? Catatonic symptoms, stupor or waxy flexibility or बताओ catatonic symptoms of schizophrenia. Stupor हो गया, waxy flexibility और posturing है ना, rigidity होता है, rigidity और automatic obedience है ना, echopraxia. What is echopraxia? नहीं, क्या एक्शन है? That is stereotyping, ना? Repetition of action is stereotyping. Echopraxia मतलब imitating, imitation of others' action. Suppose the patient is imitating the action of the psychiatrist. That is called echopraxia. Echolalia मतलब imitating speech. What others are saying, the patient will repeat. Suppose, what is your name? You will also choose what is your name. So that is just a repeating of the parrot-like speech. That is called echolalia. Okay. So these are the different types of catatonic symptoms, and also stupor is there, mutism. All these are catatonic symptoms. Then what is undifferentiated schizophrenia? There will be mixed symptoms. You can't differentiate whether it is paranoid or heavy phrenic. There is a mixture of symptoms. Okay. Then what is residual schizophrenia? Residual schizophrenia means? So there will be no active like symptoms. There will be no active symptoms. There will be some symptoms, mainly negative symptoms. Okay. Negative symptoms will be there after schizophrenia, that is residual schizophrenia. There is no active symptoms like prominent delusions or hallucinations. Okay, symbol schizophrenia means? Symbol schizophrenia. Symbol schizophrenia is? In symbol schizophrenia, the same. There will be no any active delusions or hallucinations. The symptoms like social withdrawal will be there, which is developing very gradually. That is called symbol schizophrenia. Okay, negative symptoms developing very gradually. Okay. Then paraphrenia. What is paraphrenia? Paraphrenia is actually synonym with the paranoid schizophrenia. That is paraphrenia. Okay. Then prof schizophrenia. सुना है क्या है वाला टर्म prof? क्या है prof schizophrenia? Is a rare type of schizophrenia. Same. Okay. So pro-schizophrenia we can see in patient with a MR, mental retardation. Schizophrenia occurring in a mentally retarded patient is called pro-schizophrenia. So the main clinical feature will be what? Behavioral disturbances will be more prominent. Okay. Then Bouffet-Delrent मतलब क्या है? Bouffet-Delrent. It is a type of schizophrenia. It's a French terminology. Bouffet-Delrent means it is same as that of schizophreniform disorder. सुना है क्या? Schizophreniform disorder क्या होता है इसमें? Schizophreniform disorder DSM-5 में दिया है ना? So क्या है? Duration में changes है क्या है? Less than 6 months. 1 month to 6 months is schizophreniform disorder, and 1 day to 1 month is called what? Brief psychotic disorder. Brief psychotic disorder duration is 1 day, at least 1 day to maximum 1 month duration. Okay. So Bouffet-Delrent मतलब acute delusional psychosis. Acute delusional psychosis duration should be less than 3 months. Less than 3 months. That means it is almost same as that of schizophreniform disorder. Less than 6 months है ना? There will be less than 3 months. Okay. Then latent schizophrenia means what? Latent schizophrenia is also called a borderline schizophrenia. So for example, it can be seen in case of personality disorders like schizotypal personality disorder, schizoid personality disorder, and also borderline personality disorder, which is not true. They are having chances of micropsychotic episodes in borderline personality disorder. That is called latent schizophrenia. Then what is Homoeopathic schizophrenia? नहीं, old age में नहीं है. Homoeopathic मतलब word meaning क्या होता है? Homoeopathic मतलब dreamy state. Okay, so there will be disturbances in the consciousness. So schizophrenia occurring in a disordered consciousness. That is called Homoeopathic schizophrenia. Pseudoneurotic मतलब pseudoneurotic schizophrenia is characterized by pan-anxiety. There will be prominent anxiety symptoms, phobic symptoms, sexual symptoms, and chaotic personality. That is called pseudoneurotic schizophrenia. Then post-schizophrenic depression means depression developing following schizophrenia. So depressive symptoms will be prominent. Then Van Gogh syndrome, aggression, self-injury, mutilation, self-mutilation in case of schizophrenia. Why this name Van Gogh syndrome? Because Van Gogh was a painter, he just cut his own ear during his acute schizophrenic episode. That is why the name Van Gogh syndrome. Okay. Then clinical features of schizophrenia. So it is very difficult to diagnose schizophrenia, to find out the clinical features of schizophrenia. There are some challenges, issues. One challenge is there is no definitive pathognomonic symptom of schizophrenia. We can't say this symptom is you can see only in schizophrenia. ऐसा नहीं है. Suppose एक symptom बताओ schizophrenia का, delusion. Okay, that is one exception. बाकी, for example, delusional persecution. Delusional persecution you can see in other conditions also apart from schizophrenia, such as delusional disorder or depression with psychosis, BPAD with psychosis. So we can't diagnose based only on one symptom. Okay, that is one challenge. No clinical sign or symptom is pathognomonic of schizophrenia. Second one is the symptoms will change over time. Okay, that is why some diagnosis will change over time. Initially we will diagnose something else, but after careful observation, the diagnosis will change sometimes. Okay, so the symptoms are not persistent. That is one challenge. And third one is we have to take care of the patient's education level, the background of the patient, cultural background of the patient. Why? What is the importance of knowing all these things? Education of the patient, culture of the patient. Because sometimes you are assessing MSc, We asked one question to assess the information. Because patient is illiterate, we can't write he is having schizophrenia because he is illiterate. How we can answer? So based on the educational level, we have to take care of, and also cultural background. Why cultural background is important? Because in some culture, certain practices are there. Okay, according to that culture, it is normal. We can't diagnose schizophrenia going to their culture. Because if it is sharing by a group of people, a group of community, then we can't diagnose it is a case of schizophrenia. Because it is normal according to their culture. But we can diagnose when if it is excessive of their culture. If their belief is excessive of their culture, then we can diagnose schizophrenia. Otherwise, it is normal according to their culture. Okay. Then, what are the pre-morbid signs and symptoms of a schizophrenia patient? What is the meaning of pre-morbid signs and symptoms? Symptoms developing before the disease. So, is it same as that of prodromal symptoms? दोनों same है क्या? एक ही है क्या? Prodromal symptoms and pre-morbid signs. Prodromal symptoms है ना? Prodromal symptoms दोनों एक ही है क्या? Prodromal and pre-morbid. No. Prodromal symptoms are actually a part of the disease. है ना? But pre-morbid मतलब they are not having schizophrenia. But we can find certain characteristic features in their life. Okay. So main type of pre-morbid signs and symptoms are schizoid or schizotypal personality. You know the characteristics of schizoid and schizotypal personality. And the person will be very quiet, passive and introverted and having very few friends. They don't like company. They like solitary activities. That is why they like to stay alone. Aversion to company, desire alone. Desire to be alone. That's the main pre-morbid sign of schizophrenia. Okay, so they like solitary activities like they like to watch movies, they like to play games on mobile because they don't want any company, they don't want to participate in a group play. Okay, they like solitary activities, though they are having no close friends also. Then coming to mental status examination, the patient will be generally disheveled, untidy appearance, not properly clothed, not bathed, wo wala. And the screaming, agitated person can also be a schizophrenia patient. And in type of catatonia, type of schizophrenia, you can see catatonic symptoms of schizophrenia. All those catatonic symptoms you can see. Okay. Then precox feeling. What is the meaning of precox feeling? Any idea of precox feeling? Precox feeling matlab, even an experienced psychiatrist also sometimes failed to develop a rapport with the patient. He is thinking there is a wall between me and him. That feeling is called a precox feeling. Okay, it is the difficulty in establishing an emotional rapport with the patient. That is called a precox feeling. Something is disturbing with us. He is not getting the full rapport with the patient. Okay. Then mood, feelings and affect, there is a reduced emotional responsiveness. That means affect will be reduced, either blended affect or flat affect. Constricted affect in general we can say. Anhedonia, you know, anhedonia. It is a negative symptom of schizophrenia. And there will be sometimes patient can be going to extremes of emotion, extremes of happy, extremes of rage, extremes of anxiety. Okay, even though in catatonia also two extremes can occur in catatonia. One is catatonic excitement and one is catatonic stupor. In catatonic excitement, the patient is very anxious, very angry and having excessive motor behavior. In catatonic stupor, just ulta, the patient will be immobile. There is no activity, there is no voluntary activity at all. That is catatonic stupor. Both the conditions are psychiatric emergencies. Immediately we have to take care of. Otherwise, it can lead to some complication. Okay, psychiatric emergency, excitement and stupor. Then there will be perplexity, matlab confusion, sense of isolation, ambivalence, depression. Then coming to the main symptom of schizophrenia is reflected in the thought. Okay, so schizophrenia, almost all the symptoms are there in the thought. Okay, you know how to assess the thought, MSc. Thought can be assessed by 4 headings. What are the 4 headings under thought? Thought to form, thought to flow, thought to content, and thought to possession. Okay, nowadays thought to flow and thought to form are almost the same. All the symptoms will cover both. So what are the main symptoms in thought flow and thought form? It is loosening of association. Pata hai loosening of association kya hai? Then derailment matlab derailment. It is a kind of loosening of association. The patient will change a topic from topic. There is no lack of connection also. Incoherence, incomprehensible speech. We can't understand what the patient is talking. Then tangentiality, obviously tangentiality and circumstantiality. What is the main difference between two? Goal. One goal is reached in case of circumstantiality. It is going like a circle. Ultimately the patient will answer you, but it will take time. That is circumstantiality. Tangentiality means there is no goal. You will not get the answer. Patient will deviate from topic to topic. Then neologisms, coining of new words which have no meaning. That is neologism. Echolalia to pata hai. Verbigeration. Verbigeration is a type of meaningless words. It's not necessary it will be meaningless. Can you tell one example of verbigeration? What is the difference between perseveration and verbigeration? Example करके बताओ. Okay. Okay, so both are actually a type of stereotyping, repetition of words. Simple example I can say of perseveration. Suppose I am asking the patient, what medicine you are taking to control your BP? For example, I am asking the patient, what medicine you are taking to control your BP? Patient is saying, Revolvia tincture I am taking for controlling my BP. Okay, answer mila. Then again, the physician is asking another question. After taking the medicine, how you are feeling? Answer is Revolvia tincture. Okay, again third question, how much long you are taking this medicine? Answer is Revolvia tincture. Matlab there will be same repetition of the same word या response. Even if the question is different, the answer will be the same. That is perseveration. What is verbigeration? It is also repetition of the word. For example, I am asking you, what is your ambition? What is your ambition? I asked one question. Patient is saying, my ambition is to become a doctor. Okay. My ambition is to become a doctor because I like medical subjects. My ambition is, my ambition is again, the patient is repeating again and again. That is called a verbigeration. There is no multiple question, only one question, but the patient is spontaneously using the same word again and again beyond the stimulus. That is called a verbigeration. Okay, both are actually stereotyping. Okay, repetition of words. Then word salad, same. Mixture of words which you can't understandable. That is called a word salad. Mutism, no speech. There is no speech in mutism. Then content delusion. Delusion is actually a very vast topic. We can't finish within this time. So delusion, most common types of delusion in schizophrenia. Persecutory type of delusion or grandiosity. Delusion of grandiosity can be there. Delusion of reference can be there. Delusion of reference. Okay. Then thought of possession already discussed kiya tha. Thought insertion, withdrawal and broadcasting. Okay. This is what type of delusion is this? Delusion of persecution. Means the patient is believing somebody is trying to kill me or harm me or poison me, whatever. And this is delusion of grandiosity. Okay. This is delusion of infidelity. Okay, the patient is believing that my spouse is having an extramarital relationship. Okay, delusion of infidelity. Okay. Then coming to perceptual disturbances, hallucinations can be there, illusions and body distortions. Which is the most common hallucination in schizophrenia? Auditory hallucination. It can be first person, second person, or third person auditory hallucination. Different types are there: commanding auditory hallucination, running commentary auditory hallucination, imperative auditory hallucination, elementary. Both are hallucination are there. Then visual hallucination can be there, but it is very rare. If in a case of schizophrenia you are suspecting visual hallucination, you should suspect some other causes, like some neurological causes, because normally visual hallucination is very rare in schizophrenia. Okay, visual hallucination can be associated with the organic brain syndromes. Okay. Then body distortion can be there in the form of micropsia, macropsia, megalopsia, oval. Then sometimes the patient can be agitated, having poor impulse control, and social sensitivity will be decreased, can be violent, and there will be premature death. Why? Because the patient can commit suicide. It is the cause of premature death in schizophrenia. What is the reason for suicide in schizophrenia? Depression, as a part of depression, or main thing क्या है? Main thing is hallucination and delusion. Commanding. They are giving commands. Go and suicide. They are hearing in a daily. So, due to this commanding auditory hallucination, it is very risky for the patient for committing suicide. Okay, as a part of hallucination. Then homicide can be there based on saying commands. Go and kill. Go and kill. So, it can be there. Homicide also in some patients. बाकी sensorium मतलब orientation will be normal, intact most of the time, and also if there is no orientation, then you have to suspect some other causes. Same way, some other medical or neurological causes should be ruled out, and also usually memory will be intact. We can see minor cognitive deficiencies, but most of the patients will have a intact memory. Okay, and insight will be poor, मतलब grade 1, complete denial of illness. That is grade 1 insight. Sometimes it can be grade 2, 3, 4. Okay, sometimes the patient can have insight also. He know I am having schizophrenia, I am having delusion, I am having hallucination. It can be there. Okay, we saw patient like that. They know everything about their disease. It can also occur, but mostly 90% of them are having no insight. Okay, complete denial of illness. So how will you differentiate schizophrenia from other disorders? We have to take care of medical and neurological condition. Suppose substance-induced psychosis. We have to differentiate. Alcohol can induce psychosis. So we have to differentiate alcohol-induced psychosis. Then epilepsy, we have to differentiate. Any neoplasm, brain tumor can present with psychotic symptoms. Okay. And acute intermittent porphyria, we have to differentiate. Then deficiency of the vitamin B12, poisoning with the carbon monoxide, and also heavy metal poisoning. Then homocystinuria, neurosyphilis, all these conditions can present with the psychotic symptoms. And DD from other psychiatric conditions like autism. Okay, brief psychotic disorder. Based on the duration, we can differentiate. Then delusional disorder. How will you differentiate delusional disorder and schizophrenia? In delusional disorder, there will be only delusions, which is very persistent. Hallucinations can be there, but it is transient, not persistent. And also based on the duration of symptoms. What is the criteria for diagnosing delusional disorder according to DSM? According to ICD? 3 months. 3 months will be needed. Okay. Then malingering can be there. Factitious disorder. You know what is factitious disorder and malingering? What is that? Factitious disorder and malingering ka difference?
Fabricated physical symptoms rather than he is physically ill.
Okay. So both are characterized by fabrication of symptoms.
There is a minor difference in malingering
Okay, psychological gain के लिए ना. Okay, then OCD, normal adolescence is one DD. Why normal adolescence? Because this anger outburst and all very common during adolescence, normal adolescence. Okay, so we can't diagnose schizophrenia in a normal adolescent patient who is showing some normal phenomena related to the adolescent period. Okay, then schizoaffective disorder means there will be both the symptoms of schizophrenia as well as mood disorder. Okay, schizoaffective disorder. Then schizophreniform disorder based on the duration less than 6 months. Okay. Then prognosis is very important. What are the good prognostic factors and poor prognostic factors of schizophrenia? Good prognostic factors are late onset of schizophrenia and young onset is poor prognosis. Because childhood onset is having poor prognosis, late onset is having good prognosis. Then if there is any precipitating factors are there, it is having good prognosis. Why? We can treat those precipitating factors, then we can get result. Okay. And if there is no precipitating factors, it is having poor prognosis. And other good prognostic factors are acute schizophrenia, good premorbid social, sexual and work histories, mood disorder symptoms, family history of mood disorder, marriage. Why marriage is a good prognostic sign? Because of support system. You will get some support from the family. Okay. Positive symptoms are having good prognosis, short duration of symptoms, and first episode is having good prognosis. And the poor prognostic signs are insidious onset, gradual onset, late onset schizophrenia also, poor premorbid personality, family history of schizophrenia, single, divorced or widowed, negative symptoms of schizophrenia, chronic course of disease and many relapses. Multiple episodes having poor prognosis. Can you tell me some positive and some negative symptoms of schizophrenia? Positive and negative symptoms of schizophrenia. Delusion, hallucination and disorganized thought. That is formal thought disorder are positive symptoms of schizophrenia. Negative symptoms, anhedonia, asociality, elogia, or evolution. Evolution. What is evolution? Lack of motivation. Lack of motivation. That is lack of initiative. Lack of motivation. All these are negative symptoms of schizophrenia. And these are the main rating scales used for schizophrenia. You should be thorough with all these scales. One is brief psychiatric rating scale, BPRS scale commonly. Then SAPS, positive and negative scale, and the PAN scale also. Means both positive and negative symptom scale for schizophrenia. So in that case, in which first I explained to you, we used the BPRS scale. BPRS scale, it is an 18-point scale, 18-point scale. The score was came I think around the 54 during the first visit and it goes to 24 after giving the medicine. Okay. And treatment of schizophrenia, hospitalization. It is not mandatory, all the cases should be hospitalized. When it is needed to hospitalize the patient, what are the indications for hospitalization? Baki we can treat in the OPD also. Some cases of schizophrenia, there is no need of any hospitalization. What are the indications for hospitalization? If the patient is dangerous, safety of the patient and his bystanders. If the patient is having suicidality, homicidal ideation, that is one thing. Or any other? For violent behavior in which patient can't be managed at home, we can refer to the hospital. For proper diagnosis also we can just admit the patient. Because in the first visit we can't diagnose it as a schizophrenia patient. Sometimes it needs time. So we can observe in the ward and we can diagnose accordingly. And for stabilization of the drug also. If we want to know whether our drug is acting or not, or if we have to increase the dose, potency of the dose, we can admit the patient and we can try. Okay. Then pharmacotherapy, allopathy, they are mainly giving antipsychotic medication. Antipsychotics are the mainstay of drugs for schizophrenia. You know antipsychotic medication. Any idea of antipsychotic medication? There are two types of antipsychotic medication. What are the two types? First generation antipsychotics and second generation antipsychotics. So we can say older generation and newer generation. So first generation antipsychotics means what? Their main action is what? They are dopamine receptor antagonist. Dopamine receptor antagonist. And newer generation antipsychotics cover both serotonin also, dopamine also. Serotonin dopamine antagonist is newer antipsychotics. Can you name some antipsychotic medicines which you see in your OPD? Usually, what medicine patients are taking? Allopathy medicine, antipsychotic medicine, क्यूटिपिन, ठीक है. और क्या क्या क्लोनासेपम बोल रहे हैं. क्लोरोप्लाज्म मैंने सुना नहीं. फर्स्ट जनरेशन है क्या? ओके. Main medicine are risperidone, I think, ना. Risperidone is mainly using. Risperidone one medicine is there to control the agitation of the patient. Okay, risperidone. Then you can haloperidol, है ना. Then क्यूटियापिन है, बोल दिया क्यूटियापिन. Aripiprazole है ना. Olanzapine है. So there are lots of medicine in allopathy for giving patient with the schizophrenia. Then there are so many psychosocial therapies are also there. Social skills training, family therapy we can give, assertive community treatment, group therapy, CBT, individual psychotherapy, vocational therapy, dialectical behavior therapy, art therapy, cognitive trainings. One session चाहिए इसका पूरा session करने के लिए. Then mainly we can see Murphy's puppetry. There is direct rubric in schizophrenia. Kent में नहीं दिया ना? There is no rubric in Kent, I think. Schizophrenia rubric. But Murphy's puppetry you can see direct rubric schizophrenia. And the main medicines are anacardium, aurum metallicum, lactasis and stramonium. These are the main medicine for schizophrenia. But we have to take the constitution of the patient only we can give the medicine. But if the medicine are covering from this, it will be nice. And there is catatonic schizophrenia also rubric is there. Mind में schizophrenia rubric sub rubric है catatonia. ठीक है. And all the medicine you can see chlorpromazine is actually an antipsychotic medicine. The medicine given here are totopathy. Those who are giving by the allopathy in potentized form we are giving. ये वाला chlorpromazine. Then halo means haloperidol antipsychotic medicine. Okay, बाकी ravolpia, serpine है, thalamus है. Okay, corticotropin है, convolvulus है. Okay, thiop, that is also antipsychotic medicine. Thioproparacin. Okay, so all these medicine are actually allopathic antipsychotic medication. Okay, and paranoid schizophrenia only one medicine involved, it is lachesis. Okay, paranoid schizophrenia, and you can see the subrubric like conspiracies against him there were. Okay, and enemy everyone is and okay, then surrounded by, under the bed is. Okay, you can refer these rubrics. Then only one medicine under the rubric schizophrenia, paranoid, enemy everyone is and wait for and lying in alcoholus. There is only one medicine given in Murphy's repertory. Okay, then paranoid, persecuted that he is. और medicine दिया है China, Drosera, Ignatia, Lachesis. Okay, then same medicine है anacardium, arsalbine add किया है इसमें lachesis से. And so many rubrics are there, we can't finish rubrics. So main rubrics we can relate with schizophrenia is abandoned. All the main rubrics we can correlate with schizophrenic symptomatology. Apatia, abhorrence, absurd, aloof, billowing. Depends on the clinical features of the patient we can correlate. Okay, detached, listless, impolite, vexation. Those are rubrics we have उसमें. तो बाकी दो मेडिसिन का इंडिकेशन है ऑलरेडी पता है. anacardium, aurum metallicum, lachesis, stramonium, arsalb, China, Ignatia. ठीक है, just read the books.